licensed and practicing doctor of physical therapy. In today's video, we're going to be talking about, and this is the third in a three-part video series. So in today's video, we're going to be talking about a contrast bath. What a contrast bath is when you are using both ice and heat to help heal up an injury that you may have. Ideally, a contrast bath is going to be used after 48 hours has passed, because you don't want to use heat within that first 48 hours, like we discussed in the last video. And you're wanting to primarily stick with ice, like we discussed in the very first video, within that 48-hour window. But then after that time frame, that's an area where you can start to think about using a contrast bath. So so this would be for, say, nagging injuries that are, for some reason, they're just seeming like they're just not wanting to heal. They're just it's you sprained your ankle, and you're a few weeks down the road. You've been using ice, you've been exercising, you've been doing the range of motion, you've been using some heat, but it's just seeming like it still is not, you're not able to kick or get over having still a little bit of that pain. That's the type of injury that you want to think about a contrast bath with. So, how you're going to perform a contrast bath. So, this is where, like I mentioned, you're using both ice and heat. So, the protocol for this is generally, and you can look it up online. You can see that there are different protocols that people will use for this, but ideally, I would say you're going to start off with 3 minutes of heat. So, you're going to use that heating pad, and that I showed you in the last video. I also will put the heating pad and the ice pack into the show notes for this video for those people that didn't see those first two videos. Um, but you're going to use a heating pad first. Okay, so you're going to do that for about 3 minutes on the area that is bothering you. Then you're going to, after 3 minutes, you're going to take that heating pad off, and you're going to put on either ice or a gel pack in a pillowcase. Either ice in a plastic bag, or gel pack in a pillowcase or in the sleeve that it came with, directly on the most painful spot of that injury. You're going to leave that ice in place for a minute. Then you're going to take it off, and you're going to put the heating pad back on for a minute. Then you're going to take that off. You're going to put the ice back on for a minute. Then you're going to take that off and put the heat back on for a minute. You're going to alternate through this: ice for a minute, heat for a minute, ice for a minute, heat for a minute. I would say somewhere between really 5 to 7, 8 times. And then you're going to finish with heat. So the point of this contrast bath, and this goes back to what we talked about in the very first two videos about what we're trying to do with these modalities, or these temperature modalities of ice and heat. So ice is pushing blood flow away, heat is bringing blood flow in. And it is that on off, you can think about on off of, on, I'm bringing blood flow in, off, I'm pushing it away. On, I'm bringing blood flow in with the heat. Off, I'm pushing blood flow away with the ice. That on off um, use of changing the blood flow into the area of these chronic injuries that are not kind of healing, that, as I say, like an ankle sprain, those types of injuries, that is what can help to bust up that nagging inflammation that is not healing for whatever reason, and can help pain to completely go away. Contrast baths can be really, really beneficial. Um, Sometimes they can be hard to do depending on the area that you're treating. Like ideally, the best place to use it would be like an ankle. We actually use those in the clinic with ankles quite a bit, because it's easy to do. You can just get a bucket of ice, or a bucket of water, put ice in there. So you have a bucket of ice water. You can have the person put their foot in, pull it out, put it with the heating pad, put their foot back in. It's very easy to kind of do that. That's a great way to do this. So for ankles and for those kind of nagging ankle sprains and things, this works really, really well to help break up that inflammation. You would do this uh, after you've done this. or when you're going back and forth and doing these in the time frame that we talked about, generally this is going to go about 20 or so minutes that you're going to be going through this cycle. Um, 20, 25 minutes, something like that. There's not really a wrong or a right or wrong as far as that goes. And then you can do that also, a couple of times a day. You can do that every day, and just see if that will to help to kind of give your body a kickstart to healing from that nagging injury that's just not wanting to heal. But contrast baths can be excellent for those types of injuries. This is ideal for something like an ankle sprain. A contrast bath can work really well because you want to think this is what is breaking up inflammation. So it's that use of the temperature modalities with using ice and heat to bring bring blood flow in with the heat, push it away with the ice, helps to break up those nagging areas of injuries that been harder to heal for whatever reason. So that's when for those types of things, that's what you would want to use a contrast bath for. So I hope that this provided you some good information about ways that you can use temperature control modalities to help to heal different injuries that you might have. So if you have any, hopefully this has alleviated or answered, hopefully this has answered any questions that you might have about using heat or ice. If you do have any questions, please put them into the comments and below, and I will answer them as quickly as I can. And if you are interested in trying to purchase the ice pack that we like to use, or also the heating pad that I showed you, I'll also put those into the bottom of this video show notes as well, so that you can check those out at our Amazon affiliate or Amazon associate page. If you haven't already, subscribe to the channel, and we'll catch you later. Y'all have a good one.